of a doula, there is that word now of using a fertility doula or fertility coach. And certainly for me, I encourage patients to look for it. And certain patients are especially pushed for it because I've noticed when they're having some difficulty with infertility and, fertility treatments in and of itself can be such a process. What is your feeling on that, and how do you usually recommend that people approach infertility or just trying to conceive, even if they're not seeing a fertility specialist?
Well, I think those are two great questions that are somewhat separated. I would separate them in so much that by the time people get to me in the fertility process, they typically have already gone beyond the point in which the equivalent of a fertility doula would be beneficial. Meaning, I think a fertility doula or the equivalent really is helpful for someone who has there's a level of anxiety and difficulty that comes with fertility treatments that I think is expected and is appropriate, right? I mean, beyond anything else, as you know better than anyone, like going through fertility treatment, it is both time intensive. It's depending on who a woman is, she may or may not want to tell other people. So it can be insanely isolating.
It is.
And it can be very difficult on a relationship because a woman and her partner are by definition having different experiences.
Yes.
And regardless of the cause of infertility, women are the de facto patient, right?
Yes.
The woman is the person who is going in there for ultrasound. She's the one getting blood draws. She's doing all of that. So women take on an immense amount of guilt.
True.
And there is this, sense of I should have, whatever. And when every month goes by and a woman's not pregnant, there is a sense of failure. Is this a failure? No. But it's still every month, and it's like one more month down. And it is heavily on one's heart, and it's very, very difficult to escape that. So one's entire day can become, taken over by the thought of pregnancy, the thought of having a baby. And interestingly, I think what happens is often the baby gets almost secondary to getting pregnant eventually.
Yeah.
That tends to be when someone's referred to me. When their whole life becomes encapsulated by, I need to get pregnant, and the anxiety just becomes so overwhelming that they cannot get through their day well, and there's depression that's associated with it. I mean, and the data is very mixed, but there's definitely some data suggesting that one's mood can negatively impact the likelihood of conception. Is it profound? Is it strong? No. And the only reason I make that point is I don't want women to feel that their mood is the cause of, right, because that furthers a guilt that I don't think our data is strong enough. And I don't think anyone should ever take on guilt anyway. But getting back to your original question, I think having support early in the process, right? So before we get to that hole is wonderful, and women don't have it, right? There are support groups. Sometimes people go, but often they don't. Yeah. So they're alone. And so having someone there to be a support, right? Because in truth, women often don't talk to their partners enough about this, and their partners don't know what the hell to say to them. It's like this, it's this back and forth. And then something like sex goes from being an intimate, loving, connection to being scientific and regimented. This is
very procedural. Yes, it can become procedural.
Right. So it's very, very difficult. And the whole thing, everything is about when are we going to do this? What time? What's your temperature? I mean, there's so many factors.
Yes.
It's very hard. And honestly, even before, as you were asking about, even before a woman gets to fertility treatments, just the minute you want to get pregnant, you want to be pregnant.
It's true.
I mean, it's like, it's very rare that you find someone who's like, well,
That's true.
I mean, people say that, but once you really want to be pregnant, it's like, well, why am I not pregnant already?
It's true. And you also start seeing babies everywhere.
Oh my God. It's like everywhere you look, there's a pregnant woman or there's a baby, and it's like, well, why not me?
Exactly. It's true. Very true. And that really does weigh on a lot of people. And I see it because they come into the clinic. If they're someone, who's been trying, if they're under 35, trying for a year, haven't conceived, they're coming to see me. If they're 35 or older, they've usually been trying for 6 months before they come see me. And they're ready to go. They want the fastest route to pregnancy. And then you have something like COVID that shows up, and our recommendations are hold up, wait. But we also don't have a firm timeline on when this wait will end. So for that person who wants to be pregnant now, or has already been struggling for so long and wondering when their time will come, this must feel like such a blow.
Yeah. I have several patients in my practice who have been in fertility treatments for an extended period of time. And, one of them had a transfer planned for next week, 2 weeks from now. One of them, had one planned for last week. And, one for May. They're all grieving.
Yeah.
They're grieving a transfer that, isn't happening, in part because that transfer in their mind was going to be their baby. And now that baby doesn't exist, right? And maybe that baby will, but like that, every transfer is the transfer. And with COVID, we don't know when that actual transfer is going to be. And that is so scary and so disconcerting because you have no control. And a lot of this is about control and the fertility process unto itself. And by the way, I think we lost Dr. Duke for a minute, but we'll just keep on talking like before. I think the entire fertility process takes control from a woman in so many ways, and from her partner, right? This is supposed to be something that, you say you want to have a baby, you talk about it, go do what you're going to do. At least when we're talking about a heterosexual couple, and boom. But when it doesn't happen that way, right, there's inherently loss of control. By the time you get to the point of fertility, now you're in, right, you have literally lost all control levels. And now COVID comes in, and you don't know when you're going to be able to resume fertility treatments. And that's just, it's a blow on top of a blow. And so I have seen many women who, went from being anxious. There's a level of depression that's setting in. Mm-hmm. And what's very hard for me as their physician who's trying to help is, yes, can I change doses? Yeah, sure. I can modify things to try and lift their mood to some degree. But look, I can't change what is actually happening. And I don't want to say that I'm going to medicate around the reality. So instead, we're talking about it in therapy, and I'm normalizing their feelings. Look, I feel for them. I think I would feel the same way. Like, this is unprecedented, and it's so awful.